So yes, I do have a birth plan, but I didn't want to jinx it and talk about it until I knew for sure what position she's in, and she's head down. So let's talk about it. Baby have a mind on their own and they're gonna do what they're gonna do. So I call it a birth preference. To each their own. There's no wrong way or a bad way of giving birth. This is just my choices. My whole goal has always been to go unmedicated and like a home birth, but at the hospital. Because I work in the medical field, my parent worked in the medical field, emergency happened, and I want to go unmedicated. I've always wanted to go unmedicated. I have many reasons why I don't want an epidural, but at the same time, I still want to give birth at the hospital in case anything happened. But I have midwife, not OB. Now that we know that she's head down, the plan has always been to not get induced now because of IVF and being over 35. If by 40 weeks I'm still not in labor, they will induce me. So that's why I call it a birth preference, because at the end of the day, like, I don't have control of whatever is gonna happen. I truly believe that women are powerful enough to give birth unmedicated. Yes, there's medication, it's 2025, I get that, but there's side effect to every medication. Induction only leads to a cascade of intervention. The more you get medication, the more you have side effect, the more your baby is stressed, the more your baby cannot stay longer in labor, and then that's when they rush you to do a C-section. Women that have an epidural have higher chance of having C-section. I mean, there's just cascade of intervention, and I'm trying to avoid all this. Like, really letting my body do whatever it's meant to be doing. Now, since I've never given birth, I don't know how I'm gonna doing, even though I have a high pain tolerance. The way I see it is short-term pain for long-term gain. The less medication you have, the less intervention, the faster your recovery is. Women that have no epidural, that go unmedicated, actually have faster and better recovery in the long term than the one that have epidural. Now, if C-section happen, it happens, right? Like if I decide to get an epidural because I can't stand the pain, then it is what it is. For now, I want maybe the nitric oxide gas they offer it at my hospital. The thing is, I don't know how I'm gonna like it. I hate with a passion the way that opioid and narcotic made me feel, because I had breast surgery and they prescribed like Tylenol that had was like opioid inside. I hated it. I really, really hated it. So drowsy, and I was out of it. And I'm like, I don't want to feel like this while giving birth. I want to be fully aware and in full control of my body, my mind, and everything that's happening. I don't want to be drowsy and out of it and not remembering my birth. And if I get a C-section, because I see that at work, they get knocked down so bad that they're like so drowsy because of anxiety or whatever. But that's not because of the spinal. That's because of the medication giving in the IV. And I am absolutely not getting that. So for example, there's little things like this that I don't want any medication in my IV. I want IV in my arm, not in my hand, because I want to be able to freely move everywhere. I want low monitoring as possible, meaning that I want to be able to freely move as I feel like. There's a birthing tub in the hospital, so I want to utilize that. I don't want to be tied to a bed. That's just, I don't like that. Every time I have pain, every day I stretch, I move, and that's going to be the same during labor. It's the same during contraction. Now, I don't want to give birth on my back. Back is the worst thing, the worst position you can give birth in, okay? Your pelvic floor is not meant to give birth on your back. It's like the worst position ever. So I want to give birth freely in whatever position I feel, which I'm going to find out soon with my pelvic floor therapy. I can use the squat bar. They have a stool, a birthing stool. I will give birth in whatever position I feel like. I'm gonna use heat and cold therapy for like pain management, the comb, not 35 people in my room because I see that work and it's a hell no. I want my husband, my midwife, and a nurse. That's it, end of story. Maybe an extra nurse when the baby's coming. I don't want any interruption all the time. I want my calm music. I want low light. Reading the book that really shows like the whole mindset. If someone is stressed out or something is not going well, you can literally, your cervix can literally close back down and you can push back your baby back in the uterus. Okay, so everything is mental and your ambience is so important. The people there are so important to help you give in into the birthing experience and actually help you dilate and, you know, the whole process. Obviously, like skin to skin right after, delayed cord clamping until the cord has stopped pulsating. No vacuum, no forceps, no episiotomy in any circumstance. Already plan on getting the TENS machine, which can help tremendously for women that go unmedicated, to counteract with the contraction. If I have a C-section, I want a gentle C-section. I want to be able to do skin to skin, even though they don't do it. I don't fucking care. I want skin to skin. It is so important for baby. Whatever happened, I always want my husband with the baby or me with the baby. I'm planning on keeping my placenta to get encapsulated, but I still have to find a company to do that. No formula, no pacifier, no hepatitis B vaccine, no eye ointment in the eyes, and I can go over those because they are absolutely unnecessary for normal, healthy, pregnant women. I wanted to bring my own vitamin K drops, but my husband is really not happy about that. He would like to do the shot directly. So I'm still on the fence of that, but I will still do vitamin K, of course, because that's very important. And then I have more things in detail of like if I have to get an induction, the medication, and how to progress with the medication and see how my body is liking it and how the baby is liking it, because I don't want to go high dose. I want to go slowly. And yeah, if I have a C-section, I want a tab block to help with the pain nerve and everything. And then no opioid in my IV. I really cannot stand the feeling that it made me feel. So yeah, all of this are like birth preferences, but obviously we'll find out on the day of the birth. Okay, so we'll check back on when I'm giving birth, okay, and see how that goes.